Welcome to the Stroke Interprofessional Education session.
I'm Esther, an advanced practice nurse with the National Neuroscience Institution.
And I am Dr. Kinjal Doshi, Principal Clinical Psychologist from Singapore General Hospital. We will be sharing with you on the topic of post-stroke role adjustment and its management.
These are the topics Kinjal and I will be bringing you through today: factors affecting role adjustment post-stroke, understanding the process of post-stroke role adjustment, using the person-environment occupational model, John Fisher's transition curve, and we'll also be discussing the strategies to manage post-stroke role adjustment. To assist our teaching, we will be using a case study to illustrate post-stroke role adjustment issues and management. Damien, 55-year-old CFO, had a recent stroke 3 months ago that left him with a permanent left-sided weakness and poor cognition. He is married with 3 children, all are still completing their tertiary education. His wife of 25 years is a homemaker. He hopes to be able to return back to his previous job after completing rehabilitation. As we go through the presentation, consider what would be his potential role adjustment and challenges.
This slide outlines the various factors affecting post-stroke role adjustment. These 4 indicators impact a stroke survivor's functional recovery and reintegration back into the community. The 4 factors are physical and cognitive ability or impairment, which is common in stroke survivors following a stroke. The emotional difficulties that arise due to the changes to their physical and cognitive well-being. The social factors, which includes their relationships with family members, friends, and colleagues, as well as environmental factors like the stigma they perceive from society, as well as difficulties accommodating the changes post-stroke at their workplace.
The occupational performance model highlights that each stroke survivor is not just an entity alone but should be taken as whole. This model adopts a transactional approach towards the relation between the person, the occupation, the environment, physically, culturally, and socially. A person's role is dynamic. It varies across time and context in their importance, duration, and significance. Occupation is defined as self-directed meaningful tasks and activities that an individual engages in during a lifespan. It satisfies intrinsic need for self-maintenance, expression, and life satisfaction. And the environment, defined as the context within which occupational performance takes place. An equal importance is given to cultural, socio-economic, institutional, physical, and social considerations. Next, the John Fisher's personal transition curve attempts to explain the importance of an individual to understand the impact that a change like stroke will have on their own personal construct system, and for them to be able to work through the implications for their self-perception. Any change, no matter how small, has the potential to impact on an individual and may generate conflict between existing values and beliefs. To help people move through the transition effectively, we need to understand their perception of the past, present, and future. What is their past experience of change and how it has impacted on them? How did they cope? Also, what will they be losing as part of the change and what will they be gaining? Therefore, the goal of the change agent is to help make the transition as effective and painless as possible. By providing education, information, and support, we then can help stroke survivors transit the curve and emerge on the other side. Each stage builds on the last stage and incorporates any learning, both positive and negative, from their experience, so we can see that our perception of the situation could be escalating in severity of impact and importance to our sense of self as we go through the phases. As with any personal transformation, there are no clear boundaries to any of these stages. It is more of a gradual realization that things have subtly changed. Also, as each person will experience transition through the curve at a slightly different pace. And as mentioned earlier, we may be at different places on different curves depending on just what is happening to us at the time. Much of the speed of transition will depend on the individual's self-perception, locus of control, and other past experiences. Therefore, it is important to acknowledge each stroke survivor's journey at their own pace.
We shall now discuss the management for post-stroke role adjustment. As highlighted in an earlier slide, we will address the management of post-stroke role adjustment on these 4 factors: physical and cognitive ability, psychological and emotional well-being, social factors, and environmental factors. And we will refer back to this case of Damien, who is a 55-year-old chief financial officer who had a recent stroke 3 months ago that left him with a permanent left-sided weakness and poor cognition. He is married with 3 children, all who are still completing their tertiary education, and a wife of 25 years who is a homemaker. Mr. Damien, as you remember, hopes to be able to return back to his previous job as a CFO after he has completed rehabilitation. The first factor is physical and cognitive ability. Damien suffered permanent left-sided weakness and poor cognition due to his stroke. Stroke survivors, due to the changes that they experience to their body and the mind, also experience a change in the relationship they have with their body and mind. Many experience the body and mind to no longer be reliable. In other words, they feel they cannot depend on it to function the way it did before. Management consists of physical and cognitive rehabilitation that meets the needs of the stroke survivor. Depending on the severity and nature of the impairments the stroke survivor sustained, the physiotherapist, occupational therapist, and speech therapist can create a protocol that will help the individual either rehabilitate close to their previous functioning or provide strategies to help them compensate for this difficulty. More importantly, the stroke survivor needs to be informed what is possible and realistic and what can still be accomplished in spite of their physical and cognitive difficulty. The second factor that can impact post-stroke role adjustment is the psychological and emotional well-being of the stroke survivor. In addition to dealing with the physical and cognitive impairments that one may suffer as a result of the stroke, one has to consider the impact of those difficulties on doing day-to-day functional tasks as well as duties and responsibilities consistent with the role a stroke survivor had before the stroke. The inability to do these duties and responsibilities and to carry out tasks in consistent. The third factor is social factors. Damien is married, his wife is a homemaker, and he has 3 children completing their tertiary education. He also had a high-ranking position as Chief Financial Officer for a company. The physical impairments and cognitive difficulties that Damien sustained after his stroke likely makes it difficult for him to consider returning to work or even carrying out day-to-day tasks which he was previously capable of doing independently. These changes in role identity may then promote him to socially isolate himself, not only from colleagues and friends, but even from his wife and children. It may also cause him to become less active socially, engaging in fewer activities outside of the home, including activities that he previously enjoyed. This may in fact impede his functional recovery and social reintegration. In order to circumnavigate this, it is important to highlight to his wife and 3 children as well as friends and colleagues to offer him social support, to engage and interact with him as they did before he had the stroke, and to accommodate for his difficulties. It will also benefit stroke survivors like Damien to participate in support groups for stroke survivors and caregivers, as this will validate their experience and that they are not alone in the society. The last factor is environment, specifically one around stigma. Stroke survivors are often concerned about how others, including strangers, perceive them. They're concerned about how their stroke-related impairment affects their interactions with others and their ability to perform previous roles. In the case of Damien, who is interested in returning back to his previous job, he is concerned that his stroke impairments, both physical and cognitive, may make it less likely for him to return to his role as CFO, and more importantly, return to his role as provider for his family. A key point to help stroke survivors adjust in these changes in their roles is public education. The more the public can understand about stroke and the fact that survivors of stroke may still be able to perform jobs and tasks and return to their roles as providers, the easier it would be for the stroke survivor to reintegrate back into society. We should consider that occupational therapists can assist by providing workplace assessments to determine the suitability for the stroke survivor to return to work, as well as offer suggestions for the workplace to accommodate and modify the roles and responsibilities so that they can enable the stroke survivor to return, hopefully, to the job they once held.
In summary, the take-home messages for this presentation are: post-stroke role adjustment is dependent on several factors, which may differ by each individual stroke survivor. The post-stroke journey for role adjustment is not linear, and that post-stroke supportive care to facilitate role transition is important and needs to be individualized. With this, we thank you.